I have started getting fever suddenly since yesterday, and now my body is also aching, joints are also paining. I think I have a rash also. So is it chikungunya or dengue? Or is it the more recently heard Zika? What can it be? And how do I know which of these three it is? So hello friends, I am Dr. Piyush Chaudhari getting to you the next video on the YouTube channel of Fever Care Center for Infectious Diseases. In this video, we are going to discuss about clinical features or manifestations of chikungunya fever. So as we saw in our previous video, this is a mosquito-borne viral infection which spreads through chikungunya virus because of a mosquito biting a person having that infection and then biting another person to whom the infection spreads. Typically, after a mosquito bite with such an infected mosquito, the symptoms develop in around 5 to 7 days. But on an average, there have been cases reported to have developed between anywhere from 2 days till 12 days. So basically, if someone has traveled in an area where there has been outbreak of chikungunya or there have been chikungunya cases diagnosed within last couple of weeks and then develops typical symptoms, then there is a high probability of that person having got chikungunya infection. Also, after having developed the symptoms, the virus persists in the person's blood for almost about 7 days. So during those 7 days, another mosquito biting that person potentially can spread this infection to several others in the same way as he or she has got it in the first place. So coming to the symptoms related to chikungunya, there are basically three phases. Acute phase, which is from the onset of symptoms till about 3 weeks. Subacute phase, which is from longer than 3 weeks up to 3 months, and chronic phase, which is beyond 3 months. But most importantly, it is very vital that in the acute phase, we differentiate this infection from other infections like dengue and Zika virus, which also very much spread through the same mosquitoes called Aedes aegypti. Because overall, if we see, the incidences of systemic complications are extremely less when it comes to chikungunya, whereas they can be fairly common when it comes to dengue. Therefore, during monsoon period, when patient comes with fever, body pain and joint pains with or without rash, it is extremely important to be able to differentiate between these two conditions. So first we'll see how is the fever in chikungunya. The fever in chikungunya is abrupt in onset. So a few hours back the person was fine and suddenly he or she gets fever with or without chills. Usually this fever is quite high, but it typically subsides within 2 to 3 days. Similarly, arthritis or joint pain, which is also seen in more than 95 to almost 100% of patients with chikungunya, is very classical. It involves the small joints of hands and feet, in addition to involving the wrist and ankles of the person who has got chikungunya. This pain is so severe that the person is unable to do his routine daily activities. It is at times even difficult to move in bed or carry objects. Along with that, there is swelling around the joints and also redness around the joints. These symptoms are typically more pronounced after periods of rest, whereas they may sometimes improve after mild activities. Beyond that, few patients can also have involvement of larger joints like elbows, shoulder, knees and hips, but that is relatively much less common compared to the small joints. Third important feature of chikungunya is a rash. So the rash can be of varied presentation, but the most common is generalized redness with erythematous maculopapular rash, which involves face, trunk, hands as well as legs, sometimes even palms and soles. Now this rash again typically starts on day 2 or day 3 of fever and subsides within next couple of days. Now with respect to these three symptoms, if we differentiate from dengue, then in dengue the fever typically lasts for around 5 to 7 days, whereas in chikungunya the fever usually lasts for less than 3 to 4 days. The rash in dengue typically develops after 5 to 6 days of onset of fever, whereas the rash in chikungunya can start as early as day 2 or day 3 after the onset of fever. The joint pain is not a very predominant feature of dengue, whereas it is almost always present in patients who have chikungunya. What is more important with dengue is headache, and more so typical retroorbital or periorbital frontal headache, which is extremely intense and a very common feature pointing towards dengue compared to chikungunya. As far as complications are concerned, drop in WBC count, drop in platelet count, these complications are far more pronounced when it comes to dengue, whereas they are usually not so much in chikungunya. Even if there are any drops in platelets or WBC, they are milder drops which recover quite rapidly compared to dengue. Also, complications like hypovolemic shock or postural hypotension. So, dizziness on getting up from bed because of drop in blood pressure, which is in result because of reduction in water volume in our blood, is the most important warning sign when it comes to dengue and dengue related complications. Whereas, this sign is usually not seen in chikungunya patients. Also, most of the systemic complications like brain-related meningoencephalitis features or altered sensorium-like features, heart-related myocarditis or irregular heartbeat-related features, liver-related liver function test abnormalities, acute kidney injuries, or various other hematological and biochemical derangements are far more common and pronounced when it comes to dengue, whereas they all occur in less than half to 1% of patients with chikungunya. So chikungunya has extremely low mortality rate, whereas in dengue, if not managed properly, mortality can be fairly high. But it is the morbidity because of joint pains and joint swellings which makes the person extremely symptomatic and extremely morbid, which is very important in chikungunya. In whom do we expect severe symptoms? So these are typically people who are above 45 years of age. These are more common in females compared to males. These are more common in people who have high blood pressure, hypothyroidism, chronic obstructive pulmonary disease, that is COPD, or people like all females who are pregnant. So these are the age groups plus medical conditions and kids below 1 year of age, wherein complications of chikungunya are more likely to occur, or the symptoms of chikungunya are more likely to be severe in terms of the arthritis and pain, etc. Coming to the subacute phase, so which is a phase beyond 3 weeks and up to 3 months. Now in this phase, typically there is no fever, but the symptoms are predominantly related to arthralgia or arthritis. Again, as we saw in the acute phase, it is the small joints of hands and feet which are most commonly involved, followed by wrist and ankles, and then followed in much lesser number of cases by larger joints like knees, elbows, shoulders, etc. In this, in addition to pain, there is a lot of stiffness in all these joints, making movements difficult for these people, and there can be swelling around the joints and also swelling around the tendon attachments to the joint. So tendon is a part which connects muscle to the joint. So swelling around those places where tendons attach because of inflammation of tendons, as well as synovial covering around the joints. So these symptoms are more predominant during subacute phase. Coming to chronic phase, this same arthritis like symptoms continue beyond 3 months. Then it is called chronic chikungunya or post chikungunya arthritis. In this, again, we can have typical post chikungunya chronic inflammatory rheumatism like symptoms or chronic inflammatory musculoskeletal disorder related symptoms. So rheumatism meaning the kind of joint pains which are seen in a condition called rheumatoid arthritis, so which we call Sandhivat in Marathi or Gathiyavat in Hindi. So in this, the main feature is that when the person wakes up in the morning, so typically after periods of rest, for initial 20 to 30 minutes or longer, their small joints are extremely stiff and at times also swollen and painful, making it difficult for them to do their daily activities. In many of these people, as they start doing movements, the pain or tenderness reduces after around 30 to 20 to 30 minutes. So typical like what we see in rheumatism. So when somebody presents with such symptoms, how do we say that it is chikungunya and not rheumatoid arthritis? So typically, if such a person had a chikungunya like illness in last 3 to 6 months, and if these joint related symptoms were never seen in that particular person before those 3 to 6 months, then typically this is likely to be post chikungunya inflammatory arthritis or rheumatism rather than arthritis related to rheumatoid arthritis, which is more of an autoimmune condition. Additionally, in this chronic phase, there are also symptoms because of inflammation of the tendons, tenosynovitis, and inflammation of the synovial covering of the joints, leading to swelling, redness, tenderness, and pain around the joints. Again, more common with smaller joints than the large joints. Now, anybody who has these chronic symptoms has three outcomes. Either the symptoms spontaneously resolve over a few weeks to months with or without treatment, or they keep occurring repeatedly with periods of extreme symptoms followed by no symptoms followed again by periods of extreme symptoms, or in a small percentage they may continue in a long-term chronic inflammatory arthritis wherein the patient may actually end up requiring medicines called DMARDs, which are the medicines used in treatment of rheumatoid arthritis or other similar autoimmune inflammatory arthritis like conditions. So basically, to summarize, acute, subacute and chronic phases of chikungunya with different types of presentation which are almost through and through predominated by arthralgia or arthritis. So severe joint pains making the patient extremely debilitated and having contorted joints, the condition which gives the disease name of chikungunya. There are some subtle differences when it comes to high risk groups like pregnant ladies, neonates born to infected or pregnant ladies, or elderly people or people with various chronic medical conditions. We shall be discussing those in our subsequent video on the YouTube channel of Fever Care Center for Infectious Disease. So friends, if you found this video useful, please like and share it with as many people as possible. Please don't forget to subscribe the YouTube channel of Fever Care Center for Infectious Diseases, and always remember, stay informed to stay healthy.